Despite continuous efforts to prevent HIV, it remains a major public health challenge, with millions living with the disease in South Africa. The burden of HIV affects various groups differently, with young women often facing higher risk due to social, behavioral, and structural factors. Deputy President Paul Mashatile officially opened the 12th SA AIDS Conference under the theme Unite for Change, Empower Communities, and Redefine Priorities for HIV and AIDS.
South Africa carries the highest HIV and TB burdens globally in relation to its population, with a higher prevalence amongst people aged 15 and 49. Adolescent girls and young women aged between 15 and 24 record the highest new infection per week compared to all population groups.
The United Nations has applauded the South African government for its groundbreaking role in introducing HIV preventative measures such as PrEP.
We congratulate the government of South Africa, Deputy President, SANAC, and the research, clinical community, regulators, and other advocates and partners who've worked diligently to position South Africa amongst the first countries globally that will be able to provide access to this discreet, long-acting prevention option. For many, especially adolescent girls and women, this is a game changer.
Meanwhile, civil society organizations representing people living with HIV are advocating for greater accessibility to prevention and treatment services.
We are worried that we are still relying on the external donor on accessing Lenapakave, which means with the Global Fund cycle, we know that we only have 2.5 years to have LEN, and it would only cater for only 480,000 people. We know that all these things that we're talking about are accessible mostly in the urban areas, but in the rural areas, we don't see much of these implementation and programs that are going there.
Mashatile has acknowledged the severe impact of the USAID funding cuts on such critical sectors. However, he asserted that this will not deter the fight.
Now concentrating on augmenting our domestic funding, initiating national campaigns, and exploring partnerships with the BRICS nations and the private sector in our country to address the funding deficits.
Various experts and civil society groups are expected to discuss and advance efforts to end the HIV epidemic at the conference. For Newzroom Afrika on Channel 405, I am Zola Sholwana at Emperor's Palace in Kempton Park.